Hello, we are from Group 6. We'll be presenting a group assignment on the subject Advanced Accounting Information System. The topic of the project is Issues and Challenges in Managing Information Technology in COVID-19 Applications. Now, for the first presenter, we have Nur Nadira binti Abdul Ghaffar. Next is Hazima binti Ibrahim. And lastly, for the third presenter, we have Nur Natasha Alia Kaiza binti Abdullah. My name is Nur Nadira and the first slide is about introduction. COVID-19 is a disease originated and founded in Wuhan, China on December 2019. The pandemic has affected over 200 countries and poses a threat for the healthcare system around the world. Thus, the government came up with an application that firstly could track, secondly provide information, and thirdly reported on the cases of COVID-19 to the healthcare system of the countries. So, for the problem statement for this project is the issues and challenges of using information technology to collect data, track, store, and update COVID-19 cases to the government agencies through the use of applications.
Hi, I'm Hazima binti Ibrahim. Metric number 050163 will present about the issue in tracing contact for application. Here are 4 issues we got from article that we find for this project. Okay, now I will explain in more detail for each issue. Okay, for the first issue is privacy and security protection issue. Detecting human activities is a critical step in determining the source of COVID-19 infection and limiting the virus transmission. Personal information must be only used with the consent of the person from who it's acquired, and it must not be restricted to critical population such as confirmed patient, suspect patient, and close contact. To address the challenge posed by public health emergency and disaster, the health informatic community should consider establishing a unified framework for the exchange of epidemiological data subject to privacy protection related law to fully share information and facilitate the orderly flow of information between government, agencies, and communities. However, one of the most difficult challenge for developers was to facilitate data collecting without compromising user privacy. Privacy was the most important issue, and this issue still exists in most nations with their own national application. Okay, now we move to the next issue, which is in educate internet and technology accessibility. The internet and mobile phone are common examples of digital technology. Despite the fact that 4 billion people globally access the internet in 2019, usage in high-income areas was disproportionately higher than in low and middle-income areas. Even in high-income countries, vulnerable groups may lack access to internet signal, cell phone, or wearable technology such as smartwatch, such as those in low-income neighborhood or isolated region. The stronger a country technology infrastructure, the more accurate its digital contact tracing will be. Additionally, the elderly and members of low socioeconomic economies are more susceptible to being impacted by the epidemic. This same category, however, are the least likely to buy a smart gadget. Low and middle income earners in the majority of countries utilize less technology, such as phone and smartwatch. Additionally, the elderly are less adept at using this technology. As a result, this group is more difficult to reach and receive less information about COVID-19. They are difficult to recognize if they are affected by COVID-19 disease. The majority of places in some countries are also without internet connectivity, as the majority of residents lack the financial means to purchase internet data and cannot afford to install wireless internet. Every country's government must make every effort to assist this population, particularly during this epidemic season. As a result of this difficulty, many people are unable to participate in contact tracing because they are unable to download the apps that have been installed in each nation to track COVID-19 infection. As a result, the system cannot yet be completely utilized by all citizens of the country. This issue is categorized as a testing, assessing, and maintaining issue in the software development life cycle. Okay, now for the third issue is limited spectrum and bandwidth. Okay, what is spectrum and bandwidth? The spectrum of a signal is the range of frequency contained in the signal. The bandwidth is the difference between the lowest and highest frequency in the spectrum. Another challenge is the requirement for more spectrum and bandwidth in IoT device. With the increased demand for IoT device, there is an agreement need from more spectrum and bandwidth. For example, if many devices must be accommodated, the current use of Wi-Fi or 3G, 4G network will soon become less effective. This may cause error or delay the transfer of data from device to the cloud or the desired body, potential resulting in the loss of life due to the delay tracing method and algorithm. Additionally, Wi-Fi spectrum is required to ensure sustained service and meet the world expanding data needs. Okay, it is critical that this issue remain on the global agenda even after COVID-19 as internet use continue to grow and now application place an increasing demand of Wi-Fi speed. Okay, for the last issue in future clinical information system capabilities. Based on China experience, future clinical information system should prioritize the following skill in order to better respond to public health emergencies. Rapid deployment is the first capability. To support the admission and treatment of patient with mild to moderate COVID-19, clinical information system must be deployed in the same short time frame. The information sharing capability is the second capability. During this outbreak, information such as test result and patient referral information has been frequently exchanged between medical institutions. The third skill in the ability to respond quickly to emergency using electronic health record, which is EHR. Clinical informatics experts have designed the EHR to precisely respond to COVID-19 during this outbreak. Under the software development life cycle, which is SDLC, this problem is classified as an implementation problem. Okay, that's all from the issue. Now I will show you some of the application that using since COVID-19 become a huge pandemic in the world. The first one from the left is our country application for contact tracing, which is we all know that is MySejahtera. Okay, second one is the COVID safe that apply at Australia. Third one, which is in red, is Trace Together, that application used in Singapore. And the last one is Alipay that China use. Other than Alipay, China also use WeChat for their contact tracing. Okay, that's all from me.
Now, me, Natasha Alia, will continue with the solution to the issue. First solution is healthcare center detection. Healthcare center detection will help the user to identify the availability of the clinic or hospital in their area. This solution also involves in the implementation and conversion stage of SDLC. In this stage, the developer will implement new features and test the system. The second solution is time limitation for the data to be stored. In this solution, it will help the user to ensure their safety. This solution will involve in the operation and maintenance stage of SDLC. In this stage, the developer will operate the system and modify the system from time to time. For the third solution is application without internet and permission to add multiple dependent. In this solution, it will help the user to use the application without internet data. And it is also help the user to register the application on behalf of their parent. This solution is involved in testing, assessing, and maintaining stage of SDLC. In this stage, the developer will study the effect of the system on the users. The fourth solution is capacity optimization. In this solution, it will help the user to use small amount of internet capacity so it can prevent network issues from occur. This solution will involve in the operation and maintenance stage of SDLC. In this stage, the developer will modify the system by terminating all the features and information that is no longer used by the user. Now, we will continue with contribution of issue. There are some issues that will contribute to the future research idea. One of the issue is future clinical information system. This issue will contribute to the future research idea, which is to create an innovation system from the combination of Internet of Things and AI technology. Other than that, the second issue that contribute to the future research idea is privacy protection. In this issue, it will contribute to the future research idea, which is to create secure channel for COVID-19 application. Now we will continue with future research. The first future research is combination of AI and Internet of Things technology. In this future research, the developer will study on how to develop a touchless technology. Touchless technology will help the user to minimize the interaction between healthcare workers and patients. The example of touchless technology is they use robot to send meal to the patient that is infected by COVID-19 disease. The second future research is secure channel for privacy issue. This solution will help the user to secure their personal information. The example of secure channel that the developer can develop into the application is to put lock and 2 verification steps in the application. The third future research is Smart City Application System. This future research will help the user to prevent from touching any surface that might be infected by COVID-19 disease. Other than that, it also helps the user to stay alert about the destination that they want to go. The example of Smart City Application System is Smart Transportation System, Smart Home Doorbells and Security System, Crowd Monitoring, Smart Parking, and Traffic Rerouting. In conclusion, there are 3 stages of SDLC that is involved in this article. The first stage is operation and maintenance stage of SDLC. In this stage, the developer will operate and modify the system. Next is implementation and conversion stage of SDLC. In this stage, the developer will implement the new features in the system. The next stage is testing, assessing, and maintaining stage of SDLC. In this stage, the developer will test the new features either it is suitable for the system or not. Okay, that's all from us. Thank you.